or it's not about dentists, and I think all these guys would share that with you. It's about the patients. So a little bit of information, the current reimbursement rate is only 34% of cost. That's remained unchanged since 2008. Dental health profession shortage is in 93 of the 100 counties in North Carolina, and only 45% of dentists accept Medicaid. I studied business at Appalachian State, marketing and management with an emphasis in economics. And I learned more just watching folks around where I grew up. And I got an example for you. So if you had a watermelon farmer, and that watermelon farmer is hauling watermelons, and every load he lost $100 when he hauled those watermelons, would he haul more loads? No, because he's losing $100 a load. He would stop doing that and do something else, or try to figure another way to make that work. So that's what's happening in North Carolina. Dentists cannot pay their bills on what Medicaid pays. I think you're going to hear from some professionals that will tell you that. Other states around us, Virginia, Tennessee, Alabama, have increased those Medicaid rates. This has led to a 20 to 30% increase in the number of private dentists accepting Medicaid within 3 years, and that has been a good thing. And as Senator Bergen said, this is about primary care. Senator Adcock and myself and Senator Bergen also have another bill to increase the rates for primary care physicians. So this is important health issues that are very important to our state. And with that said, thank you for having me today, and I will recognize Crystal Adams, Director. Crystal.
Thank you. Please forgive me, I'm not as polished as the senators are. I'm honored to be here today. I want to thank everyone for traveling from all over the state of North Carolina, especially those that stepped away from a full day of patient care to advocate for this issue. Your presence speaks volumes about your commitment. Today is a powerful example of what it looks like when partners come together, standing side by side, advocating for the oral health of all North Carolinians. There are also many individuals here today who may not be speaking, but who have powerful stories to share. I encourage you to connect with them after the press conference. As they mentioned, my name is Crystal Adams. I serve as the director of the North Carolina Oral Health Collaborative, a program of the Foundation for Health Leadership and Innovation. We work to improve access to oral health care across our state. We serve as a convener and a voice for safety net providers, working on the front lines every day despite significant barriers. This work is deeply personal to me. I am from Alexander County, as all of you know, a rural North Carolina community, and I did not receive dental care until I was 16 years old. Now, nearly 30 years later, we are still facing many of the same challenges. My neighbors, my friends, my family are still struggling to access care. Children are living with pain. Adults are unable to find unemployment because of their oral health. That should not be the reality in our state. We know the cost of staffing and delivering care has increased significantly, especially since 2020. Yet North Carolina ranks in the bottom third nationally for Medicaid dental reimbursement rates. If we want to improve access, we must address this gap, because access to care should not depend on where you live, what you earn, or whether a provider can afford to see you. Thank you. I would like to introduce Dr. Shelley Olson with the North Carolina Dental Society.
Thank you, Crystal. My name's Dr. Shelley Olson. I serve as the president of the North Carolina Dental Society, representing nearly 4,000 dentists across our state. I'm proud to stand here today in support of the legislation to raise dental Medicaid rates across North Carolina. I want to thank our bill sponsors, Senator Gayle Adcock, Senator Kevin Corbin, Senator Bergen, for their leadership in recognizing the urgent need to raise rates to improve access in North Carolina. I also want to thank the North Carolina Oral Health Collaborative for their partnership and advocacy on this issue. We are stronger when we work together, and today is a true testament to that. The North Carolina Dental Society strongly supports increasing dental Medicaid reimbursement rates on behalf of both providers and the patients we serve. Good oral health is vital to good overall health. When patients are able to access quality oral health care, their overall health care outcomes improve. Right now, reimbursement rates remain at levels that they were in 2008. Since then, you all know the cost of delivering care from materials to staffing has risen significantly. Without adjustments, providers face a really difficult decision about whether they can continue to serve Medicaid patients. As we've seen in other states, when reimbursement rates improve, more dentists participate, and when more dentists participate, more patients can be seen. More providers means more access. It means better health for our overall North Carolinians. So we want to continue to raise these reimbursement rates. It's not about just supporting the providers. It's about ensuring that every North Carolinian has an opportunity to receive timely dental care. Today, we are one step closer. Thank you. And I'd like to bring in Dr. Frank Kortz. I will tell you, you have no bigger champion for the citizens and the children of North Carolina than Frank Kortz.
Good morning. I have to take my glasses off. Getting old. I'm a pediatric dentist, but I'm not here for the dentists of North Carolina. I'm here to speak for the children, the adults, and the people with special needs who depend on Medicaid to support their oral health. The Medicaid oral health program in North Carolina is in trouble. Reimbursement is currently at the level seen in 2008. Access to Medicaid oral health care is in crisis, particularly in rural areas, and there are a lot of those in North Carolina. The dental care network is in decline throughout the state because the cost of care is often not covered by the reimbursement levels. Dental decay is by and large a preventable disease. Almost all dental problems can be prevented. Prevention and early treatment are key factors in the control of this disease. Without this care, the cost of treatment becomes dramatically higher and the health outcomes become much worse. Poor oral health is a significant risk factor in cardiac conditions, diabetes, dementia, and a myriad of other medical conditions. Oral health is general health. Without oral health, you're not going to have a healthy body. If dental care is not available, what occurs? Severe pain, sleepless nights, inability to chew, missed school days, missed work days, inability to concentrate and learn in our classrooms. And lastly, if the disease progresses long enough, infections that can be life-threatening. What happens when a dentist cannot be found to do dental care? Hospital emergency rooms are where people end up. The care usually results in an antibiotic, pain medication, but does not address the underlying disease. And the cost is often, between $1,800 and $2,000 for that visit. And with the antibiotics wear off and the medication is gone, they'll end up in the ER again, and it's a waste of resources and not a good way to deal with oral health. Recently, the North Carolina Institute of Medicine developed a detailed roadmap to address the medical oral health crisis. A key finding was to significantly increase reimbursement in order to maintain an adequate provider network to care for recipients. The citizens of North Carolina deserve a Medicaid oral health system that addresses prevention, early treatment, and the dental destruction caused by chronic disease. Importantly, the system will be critical in mitigating the serious medical conditions that are associated with poor oral health. This bill will be a giant step toward achieving that goal. Thank you. And I'd like to introduce Kristen Gerald, who's going to talk about perspectives from recipients.
My name is Kristen. I'm a resident of Alexander County and a licensed foster parent in Wilkes County. I'm here today not as a policy expert, but as someone living the reality of Medicaid access every day. Trying to get basic dental care for the children in my home. When a child comes into foster care, we're required to make sure they receive oral care. But what that looks like in real life is hours of phone calls, being told over and over, we don't take Medicaid or we're not accepting new patients. And if you do find someone, you're often waiting weeks to be seen. I had a child placed in my care who needed extensive dental work. It took weeks just to get an evaluation and then more weeks to get him scheduled for surgery at a surgery center over an hour and a half away from our home. That's not just inconvenient, that's a child living in pain while we wait. For other children, For my other children, the only option available has been the health department. But when a child is uncomfortable there or it's not a good fit, we don't have the ability to choose another provider because there simply aren't any. Access to care shouldn't come down to luck, distance, or whether a provider is willing to accept a child's insurance. And I'll say this honestly, I can understand how biological parents get overwhelmed and give up when every door is closed, when every appointment is weeks away. It becomes easier to stop trying. But when that happens, the children are the ones who suffer. This isn't about effort, it's about access. We need more providers who can afford to accept Medicaid. We need reimbursement rates that reflect the actual cost of care so that dentists can say yes to these kids. Because right now, there are too many saying no. These children deserve timely, quality dental care, no matter their background, no matter their insurance, and the people caring for them need a system that works with us, not against us. And I would like to introduce the next speaker, Neil Harrington from NC Child.
Thank you. Good morning. I'm Neil Harrington. I serve as the Senior Director of Policy and Research at NC Child. Thank you very much for being here today. We serve as the voice for North Carolina's children, and we advocate for policy solutions that improve the lives of all of North Carolina's kids. For much of the past few years, we've done a lot of research, analysis, and community engagement around children's oral health. We know from that research that families are struggling to access oral health care in their communities, especially families with children that have Medicaid coverage. In focus groups that we've held with parents of children with Medicaid, we heard from rural families that often have to drive hours just to find a dentist that accepts Medicaid insurance. That means children are missing school, right? Parents are missing work all day just to go to the dentist. And if they need a follow-up appointment, that entire cycle repeats. And this lack of access to oral health care negatively affects children's oral health outcomes. In the most recent data that we have, 1 in 5 kindergartners in North Carolina have untreated tooth decay. That untreated tooth decay can lead to oral pain. It can cause infections that can spread elsewhere in the body, and it can prevent children from being able to pay attention in school. As a Harnett County resident told us in a focus group we held, we wouldn't stand by if 1 out of every 5 kindergartners had a broken finger when they're trying to learn in class. But for oral health, we are standing by as 1 in 5 children have to deal with oral health issues on a day-to-day basis. This bill helps to address these problems with oral health among children and families with Medicaid by increasing reimbursement rates for dental services. Low dental rates drive non-participation in Medicaid and force providers to cap the number of Medicaid patients that they can see. In some cases, current Medicaid rates might not even cover the cost of delivering care to patients. Increasing these rates will allow providers to recoup those costs and incentivize more dentists to accept Medicaid coverage. This bill is a huge step forward for North Carolina's oral health system, and more importantly, for the more than 1 million children across our state who rely on Medicaid to stay healthy. We'd like to thank Senator Adcock and Senator Bergen and Senator Corbin for sponsoring this bill and their continued leadership on behalf of children and families in North Carolina. And we look forward to working with members of the General Assembly to move it across the finish line. Thanks very much.
Well, I think you can see the passion, the dedication, the knowledge, and the engagement of all these people who represent many other hundreds of people. And now we're counting on members of the press, not just to ask us questions, which we're open to, because anybody up here can answer your questions, but to elevate this message and to amplify these voices, so that everybody out there, not just the 170 members of this General Assembly, but the citizens out there demand that we increase Medicaid rates for dental care because they will understand the importance of it. We're happy to take your questions. Yes?
Question for anyone up there. Dentists have been calling for increased rates for a long time now. I'm wondering why, if you see that the landscape has changed and you will be more successful this year, and I'm asking especially because there's an ongoing debate about Medicaid and Medicaid payments, and is there a realistic chance when there's a debate about paying the bills that are already here?
Well, I'm going to start this. I appreciate that question, that very honest question, and here's where we have landed, is that every question unasked is unanswered. And what we know is that there's never the perfect time to do this, but there's an opportunity with every session. And we've decided and I wish Peg O'Connell were here to hear this, but we decided to take a page from the Care for Caroline playbook when they were pushing for Medicaid expansion, and it took a decade, is that we are not going to let the conversation die down. We are not going to be quiet. We're not going to go home. We're going to continue to ask for this until such time as it becomes reality, because here's what we believe. Everything looks impossible until it becomes inevitable. And I would ask anybody else up here if you want to add to that.
I would just say at the North
Come
Carolina
up to the mic.
At the Foundation for Health Leadership and Innovation, which we're the oral health program, we're not going to give up. We've been fighting for this for a long time. You can see that with our partners, we stand stronger. The North Carolina Dental Society, NC Child, North Carolina Rural Center, many others I know I'm forgetting, but we're not going to give up because we see this. I see this in my community when I go to the schools and on a daily basis. So we're going to keep fighting the fight until somebody gives us a positive answer, and then we'll go home.
Yes, please.
So you folks have said that you want the rate to come up to a certain level. Like, is there a compromise rate? Is there, like, you know, some creeping amount? Like, what's the step?
Well, you know how it works down here. Everything's a compromise, right? They say if everybody goes home and all sides don't get exactly what they want, that's a good bill. So, but here's where we're starting. We did our homework. We looked at what's happened in other states that have raised their Medicaid rates, and what they've seen is an increase in the number of Medicaid patients that currently enrolled dentists and Medicaid can accept, as well as an increase in the number of dentists who will accept Medicaid patients. So we're going for both of those. We worked this group. I may be the one at the mic, but these are the people who've really done the work. They worked with the department, with the dental Medicaid director, to come up with a realistic figure, which will take us from 34% of commercial rates to 50%. Will that be enough? We don't know, but we believe that's a good start. And that said, we are willing to work with all the stakeholders to come up with a stepwise increase in rates so that we can improve this problem.
The federal government recommends 70% of what the market index is, which is based on what insurance companies pay. This increase will take us up to the federal recommendation of 75% of that rate. I think it's reasonable to ask what the national standard is. Right now, we are significantly below Alabama, Mississippi, Louisiana, Tennessee, Virginia, South Carolina, and West Virginia. We have self-identified as the poorest reimbursing state in the Southeast. We need to realize that good hearts don't solve problems. Good hearts will, and we all have good hearts here, and we want you to know about it, but the problem needs to be solved through funding a program that actually is able to deliver the care that these people desperately need.
And I would add to that hope is not a strategy. So hope that somebody down here will wake up and go, we should do that. We're the people who are saying we should do that. Next question. Rose again.
So is there a number, like, you know, how much extra would it cost to get up to, say, 50% of the rate?
I'm going to ask Crystal for that number because I didn't bring the bill with me, Crystal.
$80 million is what we're asking for, yes. And I would like to add from the previous question that, you know, we have a lot of providers in our Medicaid system that looks like they're providers, but they may only be seeing one patient or three patients or patients that's already existing in their practice because they cannot afford. So, for example, one of my friends that I brought, Bailey, she couldn't get into an office because they only accepted they didn't accept Medicaid when she called. She reached out to me because she knows I'm an oral health provider, and then I called up there and said, Bailey, I got you an appointment because I knew the doctor. You shouldn't have to know an oral health provider to get care. You shouldn't have to know your neighbors that well. You should be able to call an office and have open door policies.
Yes, ma'am.
Is there any estimate of how much the jump to 50% would increase the access to care, or I guess negate that?
Yeah, so, I mean, we are asking for that amount of money. We know there's gonna be work on the other side of this, so we're asking for the money. We don't want, we wanna continue the work where, you know, we would love to do an oral health campaign. We would love to have someone educating providers. There's a lot of myths about Medicaid. I will say, a lot of people say, I don't wanna deal with the paperwork. I don't wanna take Medicaid. One of the things that we hear from our providers, and Dr. Alex Green and many of them are in the audience, they tell us Medicaid's one of the first checks that arrive at their office. They pay fast, but they don't pay enough, and that's our problem.
And let me give credit to Senator June Bergen here. So when the Oral Health Collaborative and the Institute of Medicine published their plan of action, one of the conversations that was held prior to that was from Senator Bergen, who said, we can't just do it through legislation. This group needs a plan of action of how you're going to engage dentists, educate them, debunk the myths, and actually drive that enrollment. And so we thank you, Senator Bergen, for asking, always ask good questions. Because we realize that you can't legislate all of this. You can open that door, you can increase the rates, you can make it possible, but this group and others just like them have to do the hard work and the heavy lift of engaging more dentists who say, yes, I want to do that. Yes?
DHS sent out a press release a bit ago that talked about the range of services Medicaid will cover. But, you know, the rates are low for those things. I'm wondering if there has been a thought that the Medicaid would cut back on the things that it reimburses for, but pay more for some basic services?
Anybody here? We don't have an agency rep here, and so I don't know that I can answer that question, but Dr. Courts would like to take a crack at it.
I think there is already a limited array of services that Medicaid provides for. Permanent crowns, endodontics, implants are not provided. I think the array of services that are currently covered are the primary care, not medical primary care, but dental primary care things that everybody deserves. I think there is new evidence that indicates that innovative treatments may actually be more effective and less costly. I think the Medicaid office here in North Carolina is fully aware of that. And, you know, getting a program to change gears in terms of what it provides and pays for is something that takes an effort and takes funding. I think our Medicaid program can evolve to become more effective as we institute some of the new evidence-based approaches to oral health care.
So we're coming up on time. We probably have time for one more question. And Rose, you've had two, so I'm going to let this gentleman do one. But you can see us afterwards.
What was interesting is, based off the last question, is that I assume that a fair amount of people who are going to be possibly gaining more access may already have a baseline of poor oral health that goes beyond primary care. So then how much of these dollars would be allotted to cover some of these more detailed and in-depth processes, treatments for their oral health that we haven't talked about, I guess?
Turn it over to the subject matter expert.
So currently, North Carolina Medicaid provides for fillings, extractions, dentures. They do provide for some root canals on anterior teeth. They provide for stainless steel crowns on children's teeth. We have a pretty robust Medicaid system. We're very fortunate here in the state of North Carolina. We're not limited to just preventive services. So, yes, it doesn't cover implants and some of the things that you see on TV, but we do provide for children and adults general basic health care needs, which are fillings, root canals, things like that.
So in closing, I just want to, go ahead, Rose, you got 2 minutes. And I'm giving them to you. You're the three-peat.
Well, this is a little bit of a provocative question, but one of the ways to increase access to care would be to loosen the restraints on dental hygienists so they could get out and be dental extenders, but that's been roundly resisted, you know, among some. And so, any thoughts about making that part of this whole ask?
So I'm going to start, and then I'm going to ask Summer if she might, I'm not trying to put you on the spot, but I happen to know this is your wheelhouse. So this is an appropriations bill. It's not a policy bill. And that's all that, that's what we were able to file in the short session. We know that very rarely is there a Hail Mary pass type of legislation that makes it on the first try. So as we look into the future and what we need to do, I don't think anything's off the table, but I would say for this particular bill, this is strictly looking at appropriations. However, I do happen to know that we have an expert here on this, Summer Wisher from Wake Smiles, if she'd like to come up and talk a little bit about this issue. And then I would say after this, we're going to, because we are trying to stay on time, we'd invite the press to come out into the quad with the rest of these people. Talk to anybody you want to. I know they would love to spend some more time with you. Come on up, Summer.
Thank you. So I'm Summer Wisher with Wake Smiles. I'm a hygienist. I've been practicing for 10 years. And I work with adults that are uninsured. So this does matter to me and our community. Scope of practice laws are really fun to talk about if you're a hygienist in North Carolina because they're not something that has changed much over many years. I think that when legislation passed to allow hygienists to perform local anesthetic, it changed a lot of things for scope of care, and it allowed us to really navigate a patient's appointment and their health and comfortability to move forward with their treatment in a way that we couldn't before. I do think that you have several hundreds of hygienists in North Carolina that would love to practice at a higher level. I think we're educated enough. I think we have hearts of gold that want to. And I think in time we can see that shift. It's happened in many other states where we have dental hygienists that are treating patients that are at risk that maybe we don't have the capability to treat with just dentists who are also having a workforce shortage. And so, like she said, this is not about scope of practice and limitations, but I think that could be a conversation that should come up if this bill passes, because it would only create greater impact to stop the spread of oral disease and promote overall health to the community.
I just want to say thanks to all of y'all for coming, and thanks to everybody here. You actually made this happen, particularly you, Chris. Thank you very much, and you can